Hello guys, welcome back to my YouTube channel. In case you are new here, please subscribe. If you have subscribed, thank you very much for your support. Like my video, share and comment, and don't forget to also to turn your notification bell so that every time I post a video you'll be the first person the first person to be notified. So today let me talk about antenatal care. So under antenatal care, not only antenatal care, but let me talk a bit broad about it. That is the preconception care, the antenatal care, and the postnatal care. What should you do when you get pregnant or when you are planning to get pregnant? Obviously, most of people they don't plan for pregnancy, or if they plan, they will go to the clinic after they've realized that they are pregnant. So preconception care will help you and your baby. It will help you whereby the doctor or the nurse will, if in case you have some condition that may be dangerous or may complicate during your pregnancy, that is the time the doctor and the nurse will prevent complication or will prevent the complication that may occur during your pregnancy. And also during the preconception care, you will be given iron folic acid, those ones that you are given when you are pregnant. And this will help to maintain or to boost your blood. Therefore, during your pregnancy, you will have enough blood for your pregnancy. And also and therefore anemia is a no go. Another thing that is also very important at this time, it will maintain the general health of your life, and it will ensure that the outcome of the pregnancy is okay. And therefore preconception is very important also, because during this is the time you will be checked for so many conditions, so that in case you have any of these conditions such as diabetes, hypertension, among other conditions that also always are dangerous during pregnancy, this is the time that they will be prevented or they will be managed well, so that you don't get any complication during pregnancy. And also another thing, this is the time you will know that your blood group and rhesus type, yeah, and your rhesus type, so that when you get pregnant immediately you reach 28 weeks, 34, and you will know when to get that anti-D at the right time. And another thing that is also very important, when you are aware that you are going to get pregnant, it reduces stress, because it is something that you are prepared of. You ensure that everything is okay before you get pregnant. So in case you did not go for preconception care and you realize you are pregnant, I don't think if somebody can stay more than 6 months before realizing that you are pregnant. But immediately you realize that you are pregnant, that is between 1 to 2 months, 4 to 8 weeks, you should come to the clinic, or you should go to the nearest clinic, so that you should be, or you will be told what to do during your pregnancy, whereby you will be told the food that you are supposed to eat. You should eat a balanced diet for the health of your baby and for your own health. You should maintain taking of those iron folic acid that you were given during preconception, or if you did not go for preconception, you will be given them at an early time, whereby they will prevent those congenital abnormalities. When I'm talking about congenital abnormalities, I'm saying those conditions that sometimes they cannot be corrected. Have you ever seen somebody and a child is born with a space in between here? Or this person is having a mass, they say a mass, that something that is swollen at the back along the spinal cord, or this person maybe has a big head or small head. These conditions can be prevented during antenatal care when you take your iron folic acid as prescribed by your doctor or your nurse. So another thing that is also very important this time that you are pregnant, you need to rest. You need to rest very well. Resting is very important. Resting will prevent premature delivery. Some people usually deliver early because they don't want to rest. Somebody is carrying 40 liters of water and this person is pregnant. What do you expect? You are overstretching your muscles, and sometimes you are somebody who has given birth 3 to 4 times. The muscles are relaxed, and when you are stretching these muscles, they will become loose and they will let the pregnancy out, to mean you will go to labor early. So you need to rest and avoid strenuous exercise. You eat well balanced diet. Well balanced diet will give you energy and also will boost your blood. During this con during this the period that you are pregnant, you should also maintain hygiene, so that some people, this time your immunity is very low, and if you don't maintain high high what if you don't maintain hygiene, you will end up with a lot of infection, and most infection that pregnant women usually get is UTI, urinary tract infection. I will tell you the reason why a pregnant woman will get urinary tract infection. This is obviously because of low immunity, and if you expose yourself to an hygienic way of living. Another thing that is also very important when you are pregnant is that you avoid stress. I don't know if I've said it, but just avoid stress and know some of the danger signs that can come during when you are pregnant. When you are pregnant and you start breathing abnormally, you know when you are not breathing normally. You should go to the hospital. When you have fevers is hotness of the body that is high, cold. Kama you touch yourself, unasikia kama uko hot, please go to the hospital. Come if some of the danger signs, when you are edematized on the face, on the lower limbs, on the hands, please go to the hospital. That is a sign of preeclampsia or eclampsia. Maybe you are having preeclampsia and you don't know. Or you are having eclampsia and you don't know. Please go to the hospital. Another thing that is also, when you are vomiting a lot. I've said when you are vomiting a lot, vomiting that you cannot consume any food, please go to the hospital. Another thing that is also very important you should note when you experience it when you are pregnant, that is when you have convulsion, when the water breaks, that is the layman language, or when the amniotic fluid break before you are above 37 weeks, please go to the hospital. Or anytime it breaks, even if you are above 37 weeks, please go to the hospital. When you are pregnant, you should, in any time, you cannot see vaginal bleeding. And if you see this when you are pregnant, please go to the hospital. Another thing that you should also know when you are pregnant, make sure that you are tested for HIV and AIDS and syphilis, and you know your blood sugar level, it is the normal, it is within the normal range. Your blood pressure, those are called antenatal profile. Those one, when you go to clinic, they will be investigated, and then you will know about them, or you will know if you are normal or you are not normal. And also you will know when, if you can deliver normally or you will go for CS, and this will help you to prepare before the time reaches, whereby you will get that person that will donate for you blood. You will get that person that will take you to the hospital in case of emergency. You will know which hospital you will go, and you will also prepare for your baby. Another thing that I want to advise you on, please avoid giving birth at home. Even by bad luck, up 1% out of 100 usually happen when somebody can get labor and deliver immediately. If that happens to you, please, after that, please go to the hospital, because during delivery there are a lot of infection prevention that should be considered, so that you don't get infection, you and your baby. Therefore, and also during delivery, please, sometimes you can get complication. What if the baby refuse to come out? What if you get antepartum hemorrhage, that is bleeding during labor, and hapo tu umekataa kwenda hospitali? What if umekuwa na prolonged labor that we don't know the cause? The causes may be so many, and I'm saying, what if you get it and you don't know the cause? These things can be prevented when you deliver in the hospital. So please, when you are pregnant, usually ensure that in any case you are getting labor, you are experiencing anything that is abnormal, usually go to the hospital. Another thing during antenatal care or antenatal time, or when you are pregnant, this is the time, if you take your iron folic acid well, you eat well balanced diet, you have rest, you sleep well, you exercise a little, and you avoid stress, you will never have premature labor. You will never have premature labor. When you follow what your doctor, what your nurse is telling you, you will never have premature labor. So please, I will just advise you, and not those iron folic acid, they usually have a lot of side effects. Not a lot, but nausea and vomiting is most of the commonest that people have been reporting. But please, if you cannot take it in the morning when there is a lot of activities that are going on, please take it at night. And if you cannot take it at all, your doctor can change it to another drug that is suitable for you, that you will continue taking it without any problem. After delivery, ensure that you take your baby for immunization, and also you maintain hygiene, you eat well to enhance the production of milk, and you will have a healthy pregnancy, a healthy delivery, a healthy postnatal, if you just follow this simple thing that some people usually ignore. Well, I'm saying some people usually ignore about them, but they are very important, and they can cost you when you don't follow them. So please, let's meet in my next video. Bye. Thank you for watching.